This video is going to address the issue of shoulder pain and as it relates to primarily lifting, but also you can extrapolate this out to other sports. Title of the talk is Dealing with Shoulder Pain or Injury, a Practical Guide to Living with a Bum Shoulder. This is something, unfortunately, I have a lot of experience with. I've had shoulder issues from about 2007, so about 7 years worth of shoulder injury. So, unfortunately, I'm well versed in dealing with shoulder pain. So first up, the initial steps. First of all, I can't really overstress this. Seek professional help. See a physiotherapist or doctor. They'll be much better able to address this if it's serious, or even if it's not serious, then you will be able to address it watching a YouTube video, or I would be able to address it via a YouTube video. So first and foremost, please seek professional help. Next step, once you've had the help of a professional, or in the case of not seeking the help of a professional, take 10 to 14 days of complete rest from your upper body training. This is just going to allow any kind of inflammation to settle down, any kind of minor stress or injuries to begin repairing, just basically to let you kind of settle down and start from a base. If the shoulder is chronically painful, ibuprofen and icing can help deal with the symptoms. So if you ice on a fairly regular basis, say 10 minutes every 1 to 2 hours, and take ibuprofen, they say 300 milligrams every 4 hours, that can help deal with the symptoms. It's not curing it, but it'll help you deal with the pain. Ideally, you will have a professional opinion and action plan. However, in lieu of this step, what I'm going to do now is set up a 3-stage kind of return to training or return to playing for a lifter or someone who's suffering from a shoulder injury. So this is after you've taken 10 to 14 days of total rest. So stage 1 is 4 weeks of mobility and structural integrity. So basically every day you're going to foam roll and stretch, preferentially the pec, lats and upper back. This is to improve range. And as good function and good range helps you to stop coming into shoulder impingement in your training. You're going to perform low-level shoulder mobility and control exercises daily. So things like wall slides, where you sit up against the wall, have your thoracic spine against the wall, elbows against the wall, wrists against the wall, and from there, in a very controlled manner, just move up and down the wall, move your hands overhead, back down. And things like band dislocates, where you take a TheraBand or a broomstick with a wide grip starting off with, and just make a full shoulder rotation, external and then internal. Things like sleeper stretch, where you lie on your side, put your elbow at 90, and then gently press your wrist down towards the floor to stretch your shoulder and internal rotation. You're going to perform rotator cuff strengthening, so like external rotations, internal rotations with a band or lying down with a dumbbell, Cuban presses with plates or bands, things like scapular press-ups, scapular retractions, scapula rows, things you can do on TRXs, those done on a daily basis just to help strengthen up the smaller muscles in the shoulder that help you articulate, that you don't necessarily work in traditional gym exercises. This is a theme that you're going to continue with the entirety of this process, and then on past when you're back to full training or playing or whatever you're doing. We're going to perform high volume, moderate intensity back exercises 3 times a week. Normally would say 5 sets of 10 is a fairly good place to start, and we're not really pushing the strength so much. We're just trying to use a load that you fatigue on by the 5th set by about rep 8 to 10. So pretty light weights, like really light weights. And we're going to say machine or strict dumbbell exercises are preferred to high force barbell exercises. So things like lat pull downs, where you bring the bar into your collarbone, a seated row machine where you perform it in a slow, controlled manner. Things like dumbbell row performed very strictly, chest supported dumbbell row, reverse dumbbell fly performed with your lying on a dumbbell bench. Everything done in a slow and controlled manner, so you're using preferentially lower traps, rhomboids, serratus anterior, rotator cuffs, weaker muscles that as soon as you start introducing velocity or load, the higher force muscles like the lats, traps are going to take over. So you want to use low load, moderate to low velocity exercises to start with. So just bodybuilding for your upper back basically with strict form. And then in week 3 and 4, you're going to introduce low level pressing. So light overhead dumbbell presses, body weight press ups, starting on the knees, and then after 2 or 3 sessions, going into full press ups. You're going to do this for 2 days a week, Monday and Friday. So say you do your pulling exercises on Monday, Wednesday, and Friday. You'll perform 2 pressing exercises for the same the same sort of programming you're using for your back routine. So 5 sets of 10, and you're performing them in a slow, controlled manner. Not too focused on gross force output just yet. Just strengthening up the area in general for 4 weeks while we're stretching and mobilizing. So that's a very general 4-week plan. So stage 2, base level strengthening, basically doing a very general preparation, preparing to go into whatever it is that you're going to go into, whether it's weightlifting, powerlifting, rugby, football, whatever it is. This is just a general kind of program that you can use from there to go into your sport-specific training. You're going to continue to mobilize and stretch daily. That's something you're not going to stop unless you're a weightlifter, in which case by the time you get into your sport-specific training where you're snatching, overhead squatting, drop snatching, whatever, that component's in your training anyway, so you don't really have to worry about it. Strongman or power lifter, you have to keep this up because the nature of the sport that you do, you're gonna tighten up, and you're gonna end up coming into the same sort of problems you had before. And we're gonna introduce pressing movements into your program, barbell and dumbbell overhead work as well as machine work if you wish. Horizontal pressing, going to stick to body weight and dumbbells. We're not going to introduce things like barbell bench press at this time. We're going to go push and pull 3 times a week using a volume-based strength program. So this is basically outlined for the program. 4 to 6 exercises per session. Equal pressing to pulling, although preferentially more pulling than pressing. So something like 2 presses and 4 pulls would be ideal, but if you want to go 3 presses, 3 pulls, that's fine. I always find it's good just to pair up those exercises. So if I do a bench press, I'm always going to do a bench row. If I do a shoulder press, I'm always going to do a pull up or a lat pull down, just to keep things balanced within your program. We're going to do 2 3-week blocks. The first block is going to start at 50% of your RM if you have a previous RM. So let's say you're going to do standing strict press. Your previous best is 140 kilos for 1. We're going to start at 70 kilos for 5 sets of 10. And we're going to work up the intensity session to session. So we have down there, we have the 3-week blocks. So you see week 1's 5 sets of 10, session 1, 5 sets of 8, session 2, 5 sets of 5 sets of 6 on session 3. And then week 2 and week 3, you can see it just follows fairly similar rep protocol. We just drop a set so the volume drops, so we can increase that intensity without overreaching too much. So the first 3 weeks should be pretty easy. Because you've had, by this stage, you'll probably had about 6 weeks off from heavy barbell lifting. It'll probably be a hard 3 weeks of training anyway. But the weight you're handling should intentionally be very light. We're just moving through the motions and letting fatigue, so like a 5 sets of 10 or 5 sets of 8, you'll let fatigue will build up and you will get a training effect out of your sessions. Although we shouldn't strain too hard against the weight because we're still coming back. Block 2, we're going to start at 60%. So we should get up to some pretty heavy weights by week 6. Week 5, week 6, start shifting heavy weights, and in something like a barbell overhead press. If you have done it before, you might start to approach personal best levels by the time you get to this stage. So that's the very basic strengthening block. During this time, you're still mobilizing and you're still doing your lower level exercises. So you're still doing your external rotations, internal rotations, all that stuff with bands or whatever. And we're progressing that on as we go. So by this stage, you should be doing a fairly robust strengthening program for your external rotators. As an example, maybe you've moved on to lying dumbbell press, or lying external rotation with the dumbbell, and maybe you're doing 5 sets of 5, or you're doing some kind of traditional strengthening protocol for it, because it's a muscle group the same as any other. You just have to keep the form strict so you're working it. You make sure you're working those muscles. Stage 3, this is the stage return to performance, and this takes as long as it takes. It could take a week, it could take a year. You just have to go through these steps to make sure that you don't re-injure your shoulder, or kind of re-inflame it or whatever. We're going to start off systematically introduce sport-specific training. So if weightlifting is your sport, you're going to systematically, maybe 2 times a week, do light snatches, light clean and jerks, and then go on to the next step where you artificially step up the intensity to allow your shoulder a chance to react to see if there's any deleterious effect to what you're doing. So let's take an example of a snatch. First session, bar. Second session, 30 kilos. Next week, 40 kilos, 50 kilos. And that's kind of, you set up a rule like you add 10 kilos every session. Give it a day at least to see if it flares up or stiffens up. And then you just do that until you're up, until you're at a training intensity that's meaningful. So another example is a power lifter. If you're doing bench press and you're systematically bringing it back into your program, say by week 4 of this process you're up to 80% loads. So if you're a 200 kilo bench presser, you're up to 160 kilos, even if it's for 3 sets of 2. A point where you can start to actually get stronger or produce a performance that was greater than prior to injury. That's when your stage returns pretty much stopped and you're just back into training. So then this can be done for rugby, football, judo, wrestling, whatever it is. For things like wrestling, rugby, a contact sport, you have to be smart with it. And this is where professional help will help a lot, so you don't overly push too far. There are boundaries and things that you can stick to. So for example, in rugby, you might start off with just lightly hitting the pad, lightly hitting the tackle bag, and then over a systematic process you build up to 50 live contacts against an opponent in a controlled manner, and then you go into a live contact situation. Areas like that, it pays to have a professional with sport specific experience. Things like powerlifting, weightlifting, strongman, we can just set up an artificial rule where we just raise intensity session to session in a systematic manner. So we've done this level, we do the next level, so on and so forth. We're going to continue with mobilization and low level strengthening 2 to 3 times a week. You don't have to do it every day anymore, so you should have your range back, you should have your strength back, or if not back, you should be strong through rotator cuffs, lower traps, serratus anterior, to the point where you only kind of have to maintain, you don't have to push it up. Although if you want to push up the strength, by all means do it, because no one's ever been too strong. I'm going to remain pain limited as much as possible with training in the future, so you're going to find variations that allow you to train completely pain free. So for example, if you're a power lifter and bench press causes a lot of pain and you want to remain a power lifter, maybe you have to train bench press indirectly. Maybe you do football bar bench press, maybe you do incline bench press, maybe you do decline bench press, and only for 4 or 5 weeks, or maybe you go into a bench shirt, or maybe you train in a slingshot and you only do the painful activity 2 to 3 weeks out from a meet, do the meet, and then go back to pain limited training. Pain is a sign that you're causing damage, so you don't really want to go through the pain, and that kind of comes up to our last point. Do not use painkillers, as being able to feel painful movement can help guide you and prevent causing further damage. So if you're doing a behind the neck snatch grip press and it hurts like crap on one side, there's a reason for that. There might be some pathology there, and that range of movements impinging on it, causing it worse. Maybe it's causing extra damage to some tear in the delt or whatever the injury is, could be making it worse. So that's why you remain pain limited, so you don't make anything worse. It's the worst thing you can do. Okay, so that concludes this talk. As always, I can't overstress the need to go see a professional. If you take this advice, you do so at your own risk. Don't sue me, all that crap. This is Mark, castironstrength.com, signing off. Till next time, bye. Till next time, bye. Till next time.